Well, 5 years ago today, Provincial Health Officer Dr. Bonne Henry announced the very first case of COVID-19 in BC. That case was first detected on January 27th, 2020. And then the following day, Dr. Henry took to the podium to announce it publicly.
Our first case of a novel coronavirus confirmed in a person here in British Columbia through the work of the BC CDC Public Health Lab. So this person is a male in his 40s and a resident of the Vancouver Coastal Health Region. He regularly travels to China for his work and was in Wuhan City on his most recent trip. We need to be very vigilant. There are people who have traveled, who are here, who might be incubating this virus, who might be becoming sick in the next couple of weeks. And that's why it's so critical that we maintain our focus.
And then, after that, everything changed. The province watched as case numbers soared. It implemented public health restrictions to try to flatten the curve, if you remember that phrase. Well, joining us now to reflect on that time and how it continues to shape our world today is Provincial Health Officer Dr. Bonne Henry. Welcome back to the show, Dr. Henry.
Thank you.
Thanks for being with us. When you hear your voice from that time, from 5 years ago, what are you thinking?
Ooh, when you asked me to come on the show, I was thinking about this and I had been very anxious about what was going on in China for a good month and a bit before this happened. And we had planned to do a press briefing that morning just to increase awareness and to let people know that we were setting up surveillance, that we were looking for it. And then the case was identified over the weekend. So it ended up being the announcement of our first case. So I knew for sure that it was starting and didn't know how long or how severe it was going to be.
Are we better off today in terms of our ability to respond to a pandemic than we were 5 years ago?
Wow, that's a tough question. I think we are still in that phase, and I've said this before, of collective forgetting and wanting it to be past and over. And in some ways, that makes it more challenging for us. I know, like when we put masks back into healthcare settings because we have increased respiratory viruses in the community, it makes people very anxious. Some people get quite angry at it. And it is, I think, a reflection of a collective trauma that we've all been through in the last, it's 5 years now. And so in some ways we are very much well prepared. We have a really strong public health system. We have great surveillance. We have wastewater surveillance. We've done genomics. And all of that is advanced. And vaccination has advanced in tremendous ways. But in other ways, we all want to be over it and we don't want to talk about it anymore. So it can be a challenge to keep awareness and to keep up that network that we have that watches for this, that's prepared, that tells people that what things that we can do and that we need to be aware of.
I guess it's interesting because, everything that's been said and done about masking, it was the 6th of January that we had a mandate to bring back masks into healthcare settings where people are being treated. I happened to have occasion to visit an emergency department over the weekend where maybe 20% of people were wearing masks and most of the medical staff were not wearing masks.
That's unfortunate. Especially emergency departments. We know those are the settings where people are at highest risk, where people who have respiratory illnesses are coming in to seek treatment. And so that's an area where we really encourage it. But I think it reflects what I was just talking about, that people want this to be over. And I think we need to be concerned. There's other viruses that are out there. We need to watch them. We don't need to change our lives in dramatic ways like we did before we had vaccines and when this new virus came and was causing such severe illness. But we do need to have that degree of awareness and I would say common sense, cleaning our hands regularly, making it okay to stay home if you're sick and you think you might have something you're going to pass on to others. Those common things that should be part of our our way of being in society right
Right.
now.
Well, it seems to me that some things have stuck and some haven't. I mean, I think most people now have, the good sense to stay home if they're feeling, and in some cases they have to be quite ill to do it, but stay home from work if they are able. The other part of this is, I mean, could you imagine, given where we are in the world right now, what would happen if we had another pandemic at this moment? Do you think you would see people wearing masks? Do you think you would see people getting vaccinated at the rate we saw 5 years ago or 4 years ago?
I think it depends. So right now, as you know, we're watching very carefully the H5N1 that's been spreading in poultry. We had one case here in BC, a young person who got quite severely ill. So if it was a virus that was making young people severely ill, I think we would may be very cautious about it. We would take the measures that we need to. And, we've advanced vaccine technology so that we know it's likely to be available much sooner. So that is a really good thing. And if we think back to 2009 when we had the H1N1 pandemic, vaccine was available quite rapidly, and it really dramatically changed the landscape so that we didn't end up with that multi-year trauma that we had to go through with COVID-19.
But the political landscape has also shifted. I mean, in Alberta, you have a task force that Premier Daniel Smith commissioned to review Alberta's COVID-19 pandemic response and released its final report. That report was posted on Friday afternoon, and it recommends halting the use of COVID-19 vaccines without full disclosure of their potential risks, and the province to allow physicians to prescribe alternative treatment options for the virus, such as ivermectin and hydroxychloroquine. I mean,
Hydroxychloroquine.
yeah, this is taking us back to the dark times.
It is, and I think it's very unfortunate. I can see that, perhaps the government was not as enamored of these points of views as they were when they commissioned this report, in that they released it on a Friday afternoon. But it's clearly misinformation. We know so much about the vaccine, how effective it is, how safe it is, who it works in, how long it works. We have the consensus of science. And I absolutely agree. Science is changing over time. It's it's science in action, and we saw that through the pandemic. But there's no denying that we've had millions and millions and millions of people, actually billions of people who've been vaccinated, who are protected. We know a lot about how long it lasts, your immune system, about hybrid immunity. So to have a report like this is really, in some ways, embarrassing, and it's not kept up with what we know about vaccines, what we know about, ivermectin is an important medication for certain infections. It doesn't work against this virus, and I think that's clear. So we need to have rational voices who come out and say, okay, this was a point of view from some people who had very strong opinions, but it's certainly not what we would expect most scientists to agree to or think these days.
It was on January 27th, 2020, that the first case of COVID was detected here in British Columbia. It was on this day 5 years ago that Dr. Bonne Henry announced it publicly, and Dr. Henry joins us this morning just to reflect on that time. Dr. Henry, you mentioned off the top that you had been watching the spread of COVID before it hit British Columbia, when it was first talked about in, I guess, December, January of 2019, 2020. Were you afraid of what might come when you were standing at that podium making that announcement?
I had an idea. I've been working in pandemic preparedness for quite a long time, several decades, and I had a sense of what the possibilities were for the future. I knew, as you may know, I was involved with the SARS outbreak in Toronto. We had that pandemic in 2009, the influenza pandemic. So I had a sense that this was going to be a tough time. And there were several scenarios that could have happened. And then when we started to see healthcare systems being overwhelmed in places like Italy and New York City. We really needed to take action here. So I think I absolutely had an idea of the possibilities, but we needed to bring people along to understand what those might be. And I wasn't sure which road we would go under, whether we would be able to weather especially that first big wave when it first comes into a community and starts to spread rapidly. Would it go away that summer once the season changed, once we got through that first wave? When would we have vaccine? All of those were still such unknowns.
As I mentioned, politics has certainly changed. It feels very much like the world we live in has changed very much since 2020. Today marks another grim anniversary, which is, COVID had a tremendous impact on you personally and on your life, but it was 5 years ago today that following that news conference, you had a threat on your life.
I did, and it was the first of many, which became quite challenging, and I'm certainly not the only one. There were other spokespeople across the country who received death threats. And, it continues today. It's much less than it used to be. And I have to say, the other thing that I hear a lot is how people are appreciative of the work that we did to try and steer people through what was a very, very difficult time. So I do get that as well, which is really nice.
When you talk about the vitriol that was attached to this, you see things like U.S. former President Joe Biden having to preemptively pardon Anthony Fauci because he might be persecuted by the current administration for his role as a public health official in COVID-19. Could you imagine such a thing having happened?
Well, I have to say, it was a bit distressing this past fall when one of the party platforms was to fire me. It's not that far away that people who feel very strongly about how we managed through the pandemic are trying to appeal to people who were very much harmed by the measures we put in place. And I think that's part of the challenge that I face is we know going into these types of events that there's going to be harms no matter what you do, and trying to find the balance of protecting people and protecting lives, particularly lives of seniors and elders who are more susceptible to this virus. But we know in doing that, it's going to cause effects on people who aren't as at risk of the virus. And it was very challenging, and especially early on before we had vaccine, the measures that we put in place to keep people apart, to reduce those contacts, they're very hard on young people particularly. And I know that, and I know they were hard on certain businesses particularly. So trying to make sure that we provide support to those businesses that were most affected. And that's where, we worked with government. But we needed to protect people's lives first and foremost. And, it's a very heavy decisions to make, and trying to find that balance is never easy.
Has COVID changed who you are?
That's a very good question. I don't think who I am. I think back to the day with I coined that phrase about being kind and being calm. And I think that is very much who I am. And the importance of that is more so than even when we started this. The fact that we are connected, that kindness comes from that sense of kin, I believe that, and I believe more than ever with what's happening politically, with this discourse, with the concerns the very real concerns people have about housing, about the economy, about what's happening in the United States and how it might affect us. More than ever, we need to take a step back and remember that we've all been through a very difficult 5 years. Everybody has suffered. But we can support each other as we're getting out of this and we're facing the next challenges that we're going to face, because it hasn't stopped.
Dr. Henry, thank you so much for the time this morning.
Well, thank you very much.
We appreciate it. You take care. Bye-bye. That is Dr. Bonne Henry, BC's Provincial Health Officer. Yes, it was 5 years ago today that the province announced the first case of COVID-19 in BC.